What's up, guys? This is Eric with Olympic Health Physics, and today we're going to be talking about veterinarian shielding designs. All right, so we're talking about shielding designs today, specifically for veterinarian applications. So what are we shielding? We're shielding the X-ray units that are installed in veterinarian hospitals. Oftentimes we will also shield dental spaces. We're not going to be talking about dental today, just the X-ray is what we're going to be talking about today. So why do we need shielding at all? The reason that we need shielding is so that we can demonstrate that we are not exposing members of the public or other workers to radiation unnecessarily. So we want to create a shield around the X-ray unit or the room that the X-ray unit is in to make sure that the radiation that's produced, either primary radiation or scatter radiation, stays in that space. So what are the factors that we actually need to consider when we're talking about shielding a veterinarian radiographic space? Well, we need a number of factors, and all of the information that we need comes from a guidance document called NCRP report number 148, which is Radiation Protection in Veterinary Medicine. And in the appendix, it walks us through exactly how to do a shielding design. The pieces of information that we need are the max operating kV. So what's the max operating kV that you're going to use clinically, as well as what is the average mass that you're going to use clinically. In addition to that, we also need to know how many patients per week are going to receive X-ray imaging. And between those three values, we can determine the workload, or how much radiation is going to be generated within that space for a given week. We convert that to milliamp minutes per week to get the workload. We also need to know the use factor. The use factor is how often the X-ray tube is pointed or radiation is incident on a particular barrier. So oftentimes, if you're in a single story building, there's no occupancy above or below the X-ray space, then we only consider scatter radiation. If you have a multiple story building and you are directing the useful beam either into the floor or into a wall, then in that case, we would need to consider the use, or how often it's going to be pointed at a particular wall, to understand the primary radiation. In most veterinarian applications, the X-ray tube is just pointed at the floor. Most veterinarian hospitals are in a single-story building, or if it isn't in a single-story building, the X-ray will be on the first floor with nothing below. And in those cases, we can just assume scatter radiation, which is a little bit easier to deal with from a shielding perspective. In addition to the workload and the use factor, we also need to know the occupancy factor. The occupancy factor is a description of what is in the surrounding areas that are around the X-ray room. So is it a hallway on the other side, or is it a office or a bathroom, or is it outside, exterior to the building? We need to know what is around the X-ray room so that we can apply the correct occupancy factor. And the best way for us to do this is to get a floor map. And that floor map should be to scale so that we know what the distances are from the X-ray unit itself to each of the different barriers. With that floor map, we can measure those distances, and we can also determine what is on the other side of each wall. From there, we need to know a description of what is in each barrier that is already in the room. So are we talking about just standard gypsum wallboard? Are we talking about exterior walls with concrete masonry unit blocks, concrete blocks? What is in the walls already? Has the room previously been shielded? Is there already maybe lead in the walls? And so we would want to know that information before we get started on the shielding design. Oftentimes we can get that information if it's an older building using as-builts from the architect, or potentially we could use a previous shielding design that was done in the past. From there, we get what's called WUT over PD squared. So what are those things? We've already talked about each of these factors. So W, that's the workload. U, that's the use factor. T, that's the occupancy factor. And we're going to multiply those numbers and divide by PD squared. P is the design goal, which we haven't talked about. So the design goal is the amount of radiation dose that we're allowed to go through the wall. And then we're going to multiply that times the distance from the X-ray source to the barrier squared. Once we get that WUT over PD squared, we can use that information to go back to a lookup table in our guidance documents in that NCRP report number 148. We can go back there and we can look up that value against the max operating voltage, the max kVp, and determine the amount of shielding that needs to be put into the barrier. For veterinarian X-ray, oftentimes we find that we can shield the room with simple drywall, or perhaps additional layers of drywall or thicker drywall, gypsum wallboard. We can usually do that. There are some applications that we do need to put lead into the walls because it would be too much drywall stacked on top of each other. So there are some situations that we do need to put lead in the walls. When we prescribe any kind of shielding, it needs to extend from the floor to a height of 7 feet. And any barrier penetrations for things like outlets or ductwork would need to be backed or somehow stopped with the equivalent material that's prescribed in the rest of the wall. Additionally, for veterinarian X-ray installations, we oftentimes don't see control rooms. That is a pretty standard practice in veterinarian medicine. And the last thing to know about the veterinarian shielding designs is that even though we may not need to put lead in the walls, oftentimes the actual shielding design is going to be required by a regulatory agency, normally a state. So if you're installing a new X-ray unit in a veterinarian suite, it would be important to understand what are the actual requirements for producing a radiation shielding design for veterinarian spaces. So now you know why we shield veterinarian X-ray units, what's the reason or the purpose behind it, what are the typical shielding requirements that we have, what are the pieces of information that we need to produce a good quality radiation shielding design for you, and what the state agencies are going to be looking for whenever it comes to radiation shielding designs. If you do have questions about radiation shielding design for veterinarian applications, feel free to reach out. We'll be happy to take a look at your particular situation and give you some ideas on the best way that you can shield your X-ray room and make sure that you're keeping your department, your clinic, your hospital safe for your staff and your visitors.